Hello everyone, this is Dr. Aman and welcome to the YouTube channel fmge with Dr. Aman. As I have started this series on surgery subjects, uh, so in the previous two video I have already talked about the how to deal with the general surgery, how to deal with the trauma surgery. This video is all about the how to deal with the abdominal surgery, I mean the gastrointestinal surgery. So in this video I'm going to talk about mainly the esophagus, how to read the esophagus chapter for FMG. This is mainly for FMG students. So first, as we start to read the esophagus, we have to know first of all the anatomy. Anatomy means the surgical anatomy. Surgical anatomy, we have to know about the distance from the incisor to the upper constrictor to the middle constrictor to the inferior constrictor, there where the this esophagus pierces the diaphragm. So we have to know the distance, each distance from the upper incisor to the each constrictors. First things in anatomy. Second things in anatomy, we have to know about the blood supply, because blood supply is important with respect to two things. First, about the mallory waste tears, and second about the we have to know the metastasis, because mallory waste tear, we have the left gastric artery involved, and in the what to say, in the metastasis we have the left gastric vein is involved. So we have to know these two, artery and vein, with respect to esophagus anatomy. And after that we have to know the lymph nodes, because there is very special things in the esophagus, because the lymph node runs in the submucosal layer, and there might be the skip lesions. So you have to know about the lymph node. These three things we have to know in the esophagus anatomy. Then as you move to the esophagus chapter, you have to know first of all the diaphragmatic opening. There are three diaphragmatic opening. We have the the mnemonics I8, 10, 8 and 12 o'clock, like mnemonics like IVC opening. Then we have the esophagus opening. Then we have the aorta opening. So you have to know all three openings in the diaphragm, and what structure passes through these three openings. So you have to know this. Then you have to know from where the esophagus starts, from which vertebra this starts, up to which vertebra it goes. You have to know that. And then as you move further in the esophagus chapter, the most important is GERD. GERD is very important for FMG students. So read about the GERDs, everything, mainly the investigation of choice and gold standard investigation is important. You have to know the surgery, like we have the Nissan fundoplication. We have the three kind of fundoplications. You have to know all the type of fundoplication. The image based question in the fundoplication is also asked. Okay, so you have to know what is the factor which predispose to the GERDs. Okay, and we have the very important complication of the GERD, that is Barrett esophagus. So you have to know about the Barrett esophagus also in details, because Barrett esophagus is frequently asked topic. Okay, so you have to go into depth. Okay, in the Barrett esophagus chapter, you have to know what kind of metaplasia is there, what kind of surgery you will do, all these things, the histopath, goblet cells, the histopath. So you have to know all that about the Barrett esophagus. Then as you move further, we have the one injury aspects, that is the alkali injury and acidic injury. You have to know the alkali injury and acidic injury and their treatment. You have to know. After that, as you move further, you have to know about the the esophagus cancer. In esophagus cancer, you have to know the TNM staging. TNM staging is sometime it is asked, so just go through once in the TNM staging. And the you have to know the surgery. Surgery is very important. You have three kind of surgery. You have to know all the names of the surgery, and the how many openings are there we created, and where is the anastomosis we do. So these three things we have to know in the esophagus cancer. TNM staging. Okay, and there are two types of cancer: squamous cells and adenocarcinoma. So you have to know the sites where is this squamous cell cancer and what is the site of adenocarcinoma. What is the risk factor? Because they ask the question on the mainly risk factor, like we have the suppose GERD causes adenocarcinoma, Plummer-Vinson syndrome causes squamous cell carcinoma. So you have to know what is the risk factor for squamous cell carcinoma and what is for the adenocarcinoma. So you have to know that. As you move further, this is all the carcinoma. Okay, and there is one very special classification about the Sievert's classification. Sievert's classification, you have to know there are three types. Okay, so according to the distance, like from the J junction to the upper 5 centimeter, then from the 1 centimeter above the JE junction to the distal 2 centimeter. It is type 2. So there are 3 types. You have to know the Sievert's classification. Okay, this is also included in the what to say, the esophageal cancers. And as you move further, you have to know about the tracheoesophageal fistula. Tracheoesophageal fistula is very, very important. This is linked with the pediatrics as well. Okay, so either you study from here or from the pediatrics, anywhere you can study. You have to know tracheoesophageal fistula in details, all types A, B, C, D, E, F, all types. Okay, and you have to know the what to say, the classific their management. Okay, Waterston criteria is there. You have to know that how we deal with the tracheoesophageal fistula surgery, because it depends on the weight of the baby and the pneumonia present or not. So you have to know the Waterston criteria. And after that, yes, the treatment of tracheoesophageal fistula also you have to know. And even the image based question also asked from the tracheoesophageal fistula chapter. So you have to know TEF in very details. Okay, and there are one defect which is associated with the TEF, that is vectoral defect, VACTERL, vectoral defect. So you have to know all the full form of the vectoral, like VACTE, like that. Okay, so you have to know all these things or the vectoral defects. So this is all about the what to say about the esophagus chapter. So this much you have to know in the esophagus. Okay, at least this much. 95% questions asked from these topics. Okay, so just write down these topics, like in each and every video I say, just write down these all topics in the white paper and go just through once through these topics and go to the PYQ. You will see all the questions asked from these topics. So thank you so much, and see you in the next video.